Good afternoon, Matt. Thank you so much for joining us. Really appreciate you taking the time to do this, and we're so excited to talk to you.
My name is Matt Trowbridge. I'm a physician, associate professor at the University of Virginia School of Medicine, and I teach in the medical school itself in both the clinical context. Also, I teach what I call the UVA Medical Design Program, where we teach design thinking to medical students and residents. And then I also do research on the built environment and health, which is something I've been doing for over 10 years now.
Thank you. Yeah, that's exactly why we want to talk to you. All of those things are super relevant right now. I wanted to start with a kind of a softball question, just to get in the headspace we're in right now. So with the pandemic, all of our day-to-day lives have changed, even if the work we do has stayed the same. Given your involvement with the UVA hospital and the medical school, how has your work actually changed since the pandemic began?
So one of the most radical things that, of course, occurred was that all of our students had to leave the clinical rotations and go home. So we suddenly, like educators across the country and across domains, we had to figure out in a matter of a week how to make medical school virtual, which has been incredibly challenging and very stressful. Not just for that's a hard work for us, but it's important. It's really stressful for our medical students, who particularly are third years, who have waited for this exact moment to be finally, transitioning into their clinical rotations and finally, getting into the hospital, taking care of real patients. And so it's been a very challenging time. And we've had to, figure out how to bring as much of that clinical experience to our students and also just satisfy very real things like, how do we make sure they're getting enough credits for graduation and all these sorts of things. The honest truth is we're still figuring this out. I think there's a lot of work going on to figure out, how can you bring as much of the virtual clinical care component to students as possible, but it's a work in progress.
So much of your writing, research, and teaching and passion about public health focuses on the impact design can have on health outcomes. How has COVID-19 shifted your thinking about the connection between public space and public health?
Well, COVID hasn't really shifted my thinking about the importance of public space and public health. I think it's just brought it into very clear relief. I think now it's a things like our paths, here in Charlottesville, have always been popular. Now they're essential, and I think they're seen as essential by a lot of people. I think people are realizing that, what it means to be in public space, we take it for granted, and now I think you appreciate open areas that are accessible to your home, opportunities for safe exercise, opportunities to, be walkable to things. I think public space is suddenly it's on everyone's mind. And so that's something we that think about the built environment have known for a long time. I just think it's more in the public eye is really the way I would say it.
I think it goes beyond just the access we have to natural areas. I think it's also about the protocols around shared public spaces like the post office or anything related to our civic functions. I think I would consider a grocery store public space, and the way we behave in those spaces and the way they're set up is also coming into sharp relief.
Absolutely. Everywhere is suddenly a public space, whether you're inside a building or out. And I think it's a stressful time, and that every single organization or every building owner is suddenly faced with this, this complex thing that whether they knew it or not, they had customers and those customers are suddenly thinking about, hey, how well are you managing your facility, and how was it designed, and how well are you adapting to use it in this new way during COVID?
As a designer, I feel like the amount of research that's available that directly links building strategies with health outcomes is fairly sparse. How can we capture this moment to produce data for the next wave?
So I think what you really need is interest and participation. And I think that is what COVID is really generating. For example, as we were talking about, I think there's just a huge interest right now in transparency among building occupants. They just want to know more about the building, more about the policies in place. And I think that's been something that we've always wanted for things like sustainability. How do you build engagement with a building so that, like, if you've built in an amazing HVAC system or lighting system, just making sure it's been being used appropriately. So I think it's going to be the same way for health. I think that perhaps COVID will make people want to know and be more actively involved. So if everyone in the group knows that they're coming back to work, but perhaps before a vaccine is available, but we have to come back to work. Well, we're all going to need to be able to trust each other and trust the building, trust the policies that are in place. Engagement is possible, I think, in a brand new way, because we all suddenly have been forced into realizing and taking stock of what is the environment I live in? How does it impact, how I interact with people? There's an amazing story here, I think, about kind of realizing what it must be like to walk around perhaps as a patient who's immune compromised on a daily basis. Well, we're all experiencing that, this sense of like, hey, I need some more physical space right now, or I need something out of the environment. Which environments provide that for me? Give me that flexibility to get what I need while also still trying to maintain a social connection. So I think just the fact that we've all had that shared experience, that's going to drive engagement, I believe, going forward. And I think it's up to us as kind of thought leaders in this space to take advantage of that and encourage that, particularly once this pandemic subsides.
You have compellingly argued that buildings are not inert. They can either help or hurt. The question on everybody's mind right now is, how do we reopen? How do we go back to work? From your perspective, how big of a role do the buildings play and the spaces play in this plan?
I know there won't be a perfect checklist, for ensuring safe reopening of any building or organization. I think instead you can make a commitment to following and being transparent about a systematic process that you're going to follow. Making those features, those policies transparent to the people who are going to be using your building. I think that's going to be the mark of a high-performance organization. We're going to have to work through an environment that we're not used to being in. I think one where you really cannot assure 100% safety just from the building alone. Ultimately, it's going to be about having a kind of a shared trust and a kind of a mutual agreement, mutual engagement, as we've been talking about, among the people who are going to use a building together, that we can trust each other. We're going to abide by a set of guidelines, and we are going to invest in things that I think will be forthcoming, like a much more universal testing and engagement with systems like contact tracing. That's what we're going to need. But I think you're going to have to keep changing and evaluating your process periodically as the available technologies and available health kind of options change, because they will change. And but this won't be done in a week. But I am optimistic that we're going to find ways to get back into, kind of resuming some of the really core functions of our society. But it won't be the same thing as it was before. It's going to be something new.
Matt, thank you so much for joining us.
Absolutely. This was fun.